treating suprapatellar tendinosis with cold laser and resisted terminal knee extensions, quad sets, using a Thera-Band. But I'm also going to show how I can use the cold laser. I've already set the cold laser to a, actually I haven't, but I'm going to set it right now. Cold laser, I'm going to set it to the tendinitis, which is generally about 100 seconds. And here we go. That gives him a calculated dosage of 104 joules or 13 joules per centimeter squared. Again, I'm using the Chattanooga. Turn this thing on here. Now, before I do that and hit the actual on button, I need to make sure I hand my patient his glasses. You can see nothing's on yet. I need to hand me my glasses, which I'm going to put on. So put this down for a second. And then I need to also make sure, because FDA regulations say you have to hand your patient the stop switch. So go ahead and just hang on to that. You probably won't feel anything, but if you were to, you could hit that and it will stop everything. So I'm going to turn this on. Again, this is a pretty skinny knee, and I'm going to want to kind of come underneath here, so I have to be careful I don't hit and reflect back from shiny surfaces over there. So here I go on. You can see the LEDs. Let's just hold this here, and I want you to tell me, just wave your hand or something, if you feel like any heat or anything like that. Most people don't feel a thing. I have used this once and had it done on my sore trapezius muscle, and I did feel like it felt like a little tingling, but I think it really was the heat of the LEDs, because LED does have actual healing properties. Now, one of the things I've talked about before is the cold laser. You should test out the pain level beforehand. So beforehand, when he stood up, he felt his pain at his suprapatellar area to be about a 6. And so afterwards, we're going to feel how he feels, and we'll retest that. You need to have some sort of way to test has there been effect. Now, I'm moving it around. A lot of people say you don't have to, but I think I get bored and I just want to move it around, so no harm in it. They used to say that you had to twist the laser head, but no longer do they think that's necessary, especially on this kind. There's some lasers where they have only 3 diodes for the laser itself and 1 LED in the middle. And in that case, they felt like they needed to turn it every 30 seconds to a different position, so they made sure they covered all the area. But they have learned since then that there is a spillover effect. So just keep on getting in this one area here. We have about 15 more seconds. So then after I do this laser, I'm going to then show him how to do some end range extension, which is a common thing that the patient doesn't have capabilities of doing. So I'm finished with this, put this away. They say that the end extension is probably the most important thing. That means when you lock your knee down. So let's go ahead and have you just lock your knee. You see that right there? Now do it again. Relax your leg. Now if I held your leg right here, do that again. Good. Now without pushing down at all against the table or chair here, can you go ahead and just make that muscle move? This is a very difficult thing to do. For some people, as they have injured their leg or sat too long, the muscle actually becomes kind of stupid. So we can take off our glasses if we want at this point. The thing I'm going to give you is a little Thera-Band, and all you're going to do is take this Thera-Band, and we're going to be placing this underneath your hamstrings. Now, you're going to take this loop and put this Thera-Band around a door knob when you're back at home, and you'll be standing on the ground, so I'm going to mimic this. And what you're going to do is you'll start with a bent knee, so bend your knee a little bit. There you go. Now I want you to pull your knee, straighten your leg down to the ground. So pushing against me. And then come back. Now go down there and count to 8 seconds. Contract it really hard, make it go really hard. That end range right there, what we're trying to do is get into the popliteus. Go ahead, do it again. Can you feel the tension? And relax. And we'll do it again. 1, 2, 3, 4, 5, 6, 7, 8, and relax. So I give him a set of maybe 8 to 10 seconds count. Repeat that about 10 times. Do it both legs, and then do that maybe 3 sets. All right, that's great. Thanks.